Today I want to talk about squatting, and more specifically what you should do if you have pain or limitations with squatting. I'm Dr. Lehnert, a physical therapist, certified strength and conditioning specialist, and owner of Eclipse Wellness here in Sterling, Virginia. And I work with a lot of individuals, some athletes, some active individuals, some just regular day-to-day folks. But in the end, everyone needs to be able to squat. Now you might want to squat 300 pounds in the weight room. You want to be able to just get up and down from a chair. You should be able to squat. We should figure out how it works. If there are any limitations, we should address them. Now, I want to talk about the benefits of squats. The benefits are obvious. It's the most functional movement there is. You're getting up and down all day. You're doing all sorts of stuff. Whether you're an athlete in a basketball court squatting down to grab the ball, or you're someone who's getting up and down from your desk, we're squatting all day. But it's an effective workout that we should be utilizing because it's what we call a compound movement. Compound movement is a movement that involves multiple joints. So just regular bicep curl, that's not a compound movement. But a squat, we're using a whole bunch of joints to do a whole bunch of different things. So if you're looking for more bang for your buck for your exercise, like myself, business owner, dad, I don't have a lot of time to exercise. So I like to stick to compound movements as much as I can because you're getting more bang for your buck. So squats are a great one to do that. But if you're limited in that, all of a sudden now you have to work around it. It takes longer, maybe you don't work out. There are all kinds of issues that can happen. So with the squat, it's important to understand what is required of the movement. So our basic goal when we're squatting is to bring our pelvis, the middle of our body, vertically. So we're trying to bring it as far down and as far up as we're comfortable. Now that's a big difference between a hinge or a deadlift type movement where we're trying to bring it horizontally back, horizontally forward. So in order to bring the pelvis up and down, we need all of our joints to essentially collapse and compress. So starting from the bottom, your ankles are going to dorsiflex, which is where your toes are going to come towards your shins. You're going to flex your knees, you're going to flex your hips, and your pelvis is going to move first into anterior tilt as we go down, like you're extending your back. And then when you get to the bottom, it's going to flip into posterior tilt. So we need all those movements to happen. When I see people here for an assessment for physical therapy, we tend to look at global movements and then go towards specific. So if you have pain with squatting, I want to see you squat and see what the issues are. And if there are any simple issues we can fix without looking at everything else, we want to try those. And then we want to get down into the individual joints and movement areas. So I want to start with looking at some joints here, figuring out a simple test to look at them, maybe some treatment options to give you an idea if you're at home, what could be limiting your squat and what you could do about it. So the first joint that I want to talk about is the ankle, specifically dorsiflexion of the ankle, which is bending your ankle back towards you like when you squat down. So a simple test to look at dorsiflexion is to find a wall. You're going to put one foot near the wall, facing it straight on. You're going to try to touch your knee to the wall while keeping your heel down. You're going to see how far back you can go until that heel starts to pop up, and you're going to find that spot for you. Once you find that spot, you're going to take your fist and you're going to put your fist between your foot and the wall. If the fist fits, then you're good. That's plenty of mobility there in your ankle to do that. If it doesn't fit, I want you to pay attention to the reason it doesn't fit. Are you feeling tightness in your calf back here? If that's the case, you probably should need to stretch, foam roll your calf. If you're feeling a pinching in the front of your ankle, you might need to work on ankle mobility. So I'll show you a drill for that next. And you obviously want to check out both sides when you're doing this test. If you are suffering from stiffness or tightness or pinching in the ankle joint itself, I want you to try this exercise. So you're going to take a thick band, you're going to attach it to some sort of post behind you, and you're going to put it down low. You're going to wrap it around the front of your ankle, kind of where that crease is, where you're feeling the pinching. You're going to step forward until there's tension in the band, and then you're just going to be rocking forward, keeping the heel down. You should feel that band pulling backwards against you, gently stretching that joint while you're doing these. You're going to do 2 or 3 sets of 10 of these, and then try that test again on the wall to see if it improved. Now, even if it does improve, you might have to do this every day, maybe for a couple weeks, just to work on that ankle joint mobility. I don't want you to take a couple weeks off of squatting. I want you to keep squatting. So what we do is we try to modify. Because if we stop squatting entirely, we're going to lose some of our strength, some of our mobility elsewhere. So we can grab a weight plate or anything like that and just elevate our ankles. And we can still be doing squats here where we're taking the ankles out of the equation. So we can work on the squatting technique, strength, everything like that, without taking time off. So if you have the tight ankles, give this a try, but remember, keep squatting as much as you can just to keep everything moving. So next I want to talk about the knee as it relates to the squat. So knee mobility mainly just refers to being able to flex your knee and bend it. Most people know already if they can't flex their knee enough, and they know to stretch their quads or foam roll or things like that if that's what's limiting them. But most folks can, sit in this position, get down low enough where they could be able to squat. So the thing I'm more concerned about is being able to flex your knee with load on it. So what I mean by that is most people that I see have been told at some point in their life, whether it's by a trainer, coach, friend, parent, that you should keep your weight on your heels when you're squatting. That's terrible advice in my opinion. I know where it comes from. People don't want the knees going over the toes because they're worried about injury. And that's an old school way to look at injury. But in reality, we want the knees to be able to travel because the biggest thing to understand is that our body is a lever. So if I'm trying to squat down here and come down as low as possible, if I keep my weight and my knees behind my toes, I have my weight continuing to shift back here, and what's probably going to happen is eventually I'm going to fall. I'm not going to be able to go far. What should be happening is my knees go a little bit in front of my toes to counterbalance my weight that's going back here and any weight that's on my body where my quadriceps are hanging on and they're supporting me. I'm giving them a better lever arm by letting my knees go forward over my toes so I can squat more weight, I can get deeper, my body just functions better. If I try to keep everything behind me, there's no chance that that lever can work because everything's behind that center of mass in your foot. You're going to fall on your butt and you're not going to be able to squat much. So what we want to work on is, first of all, shifting our weight to the middle of our foot, if nothing else, because that's going to let those knees relax and get them moving. That clears up a lot of issues for people that I see if I just give them permission. Shift your weight forward a little bit. Now that can feel weird at first, but it's an easy thing to understand. But the next thing that we want to try is going in kind of a split squat position here and then working on really loading forward like this, just letting the knee be the driver going forward like that. So you can hold weights when you're doing it. You can go and hold for a second here. You can do similar things with like a wall squat or anything where we're letting the knees travel forward. It's really just about getting comfortable in that position, because once you get comfortable with some weight in that position, your body kind of figures the rest of it out. So there's no real specific test for looking at that. It's more just objectively what I'm seeing when they squat and what they're telling me they're thinking about when they squat, and then working on some knee mobility when they do that. Okay, next I want to talk about the hip and the issues that we have with the hip when it comes to squatting. The next joint I want to talk about assessing is the hip joint. So the primary movement of the hip joint during squatting is flexion, so bringing your knee to your chest. So this is a simple one to test. You're just going to lay on your back comfortably here, and you're just bringing one knee to your chest as far as you're comfortable going, and then you're going to do the same thing with the other leg. You want to get at least 90 degrees because that's probably where you're squatting to. Anything beyond that is good, but it's a pretty simple test to look at. If you're limited there, you can work on just stretching, laying like that. You can foam roll your glute. There's a bunch of different things you can try there. Now, the issue most people miss with the hip is internal and external rotation. So our hip is a ball and socket joint, meaning it's spinning around constantly. So when we squat, when we're going down, we're actually externally rotating our hips in order to have room for our hip joints to move, go down through that range of motion. When we get to the bottom of the squat and we're coming out of the hole, so to speak, we're going to internally rotate our hips to drive ourselves forward. So we need a little bit of hip internal and external rotation, which is something not a lot of people are looking at, but can cause big issues, especially at the bottom of your squat. So the simplest way to look at that is if you're sitting here, externally rotating your hip is bringing your foot towards the other one there. Now, we're looking for about 60 degrees of external rotation. So that means that I'm going to be here. I should be able to rotate where if you drew a line, it would be about from the bottom here up to here, 60 degrees of movement. Now, you can have someone eyeball it for you. You can take a picture. A lot of cell phones now have apps where you can look at, joint range of motion degrees. If you have someone with you, it's easier because they can just put the phone right here on your leg and rotate you and it'll tell you the degrees. If you're by yourself, you can just take a picture where you can put the phone like this and try to feel it rotate when it does that. Not quite as accurate, but you can give it a shot. That's a good way to look at external rotation. Internal rotation is the opposite. It's gonna be your foot going out like this. So you wanna make sure you're not compensating, you're staying nice and still through here. We wanna look for about 40 degrees of internal rotation. You'd look at it the exact same way. You'd look at it on both sides. And next we'll talk about some exercises you can do to improve your hip external and internal rotation. So if we're looking at opening up hip rotation, specifically external rotation, so if I'm rotating out like this, any sort of pigeon stretch is going to be a good thing to get us into that position. So we can be here, up like this with the leg back behind us, just sinking down into that hip, trying to stretch through there. You can also elevate it on a bench. Anything like that you're pushing the hip in this position, external rotation, stretching back here, the glute muscles, and coming down through there is going to be beneficial. Now, a hip 90-90 is a good way to try to target both movements, hip internal and external rotation, where I'm going to be in this position here, externally rotating this leg, internally rotating this leg. And you can stand up here, you can gently stretch if you want to stretch more into the external rotation on one side, internal rotation on the other, and going back and forth. And then what you can do is you can switch to the other side and come down through there, looking for big limitations that probably corroborate what you saw on the table, but just trying to stretch side to side with that, getting comfortable with those movements of loosening the hips up, and then seeing how that affects the squat. Another great movement to help with hip internal rotation is an offset deadlift. So you're gonna have a weight in one hand. If my left leg is the one that's limited, I'm gonna have that in front. I'm gonna have about 90% of my weight in that left leg, the weight in the other hand. And all I'm gonna be doing is bend the knee a tiny bit. And then I'm gonna think about hinging down, thinking about pushing my hips back and slightly to the left, to the same side as that front leg, while I'm bringing the weight down here. And I'm gonna go up and down as I do that. That's giving a stretch, mobilizing the joint, easy way to load it. Any sort of exercise can be a mobility exercise when done correctly, but that's a great one that I see good results for people pretty quickly if they're looking at hip internal rotation, which is a tricky one to stretch, like I talked about that 90-90 movement. So when we talked about the ankles, I had mentioned elevating your heels is a good workaround while you're trying to work on that ankle mobility. If we're dealing with knee or hip issues, I love a box squat or any other squat with something behind you when you're exercising. So the reason for that is if I'm having trouble getting my knees over my toes, I can usually handle the beginning of the movement okay. Similarly with the hips, typically I have hip issues low down in the bottom of the squat. So what I want to do is take a bench or some sort of platform or something behind me, figuring out, okay, I have pain when I get all the way past here, so instead, I'm just gonna be here with my movement. So that way I'm able to squat, I'm able to train that movement, keep it going, while I work on mobility, gradually lower the height of this support or get rid of it altogether. That way we can keep squatting, we can keep moving. So the last body part I wanna look at is the pelvis next. An overlooked and underappreciated joint when it comes to squatting is the pelvis. So as I mentioned, when I'm going down into a squat, I anteriorly tilt my pelvis. So I'm tipping my butt back like that. When I get to the very bottom, I posteriorly pelvic tilt to come out of the movement. Now people are gonna say that that's butt wink, that's a terrible thing. That's not true, that's not the case. As long as you don't have any lower lumbar, low back issues, there's no problem with a butt wink type movement. If you want, you can stretch your hips to try to reduce that movement for a little bit more stability, but I wouldn't be too concerned about it. But the important thing is that the pelvis can actually move, because if it can't move, then all of a sudden you're gonna pitch forward, you're gonna have other issues when you're trying to move, because I see a lot of folks who are stuck, who have trouble getting out of anterior tilt, so they kind of turn into more of a hinge. I see folks where they can't anteriorly tilt, so they're kind of bent forward the whole time, they're unable to get down. There's issues that can come with it. So what you wanna do to test that is to do a little baby squat here, bend the knees a little bit, kind of athletic stance where I'm in this position. And then I want to see, can I move my pelvis back and forth here? If I have plenty of range of motion here with my pelvis, then I'm good, because I can lower down, go up, go down, and handle that load while still moving my pelvis as I'm doing it. Now, if you want to work on that, if you're stiff in some way, laying on your back with your knees bent, doing pelvic tilts, which I've talked about before, is a great exercise to start moving without gravity pushing against you. Once that becomes easy, you sit in a chair, do the same thing, tilting the pelvis back and forth, then eventually doing it standing. You're working on mobility, you're also working on the coordination of your brain, understanding what your pelvis is and how to move it. And then once you unlock that in standing, then you don't have to think about it as much when you're squatting. Because I don't want you to think about when you're squatting, what is my pelvis doing? I want you to just have that movement capacity that you can handle it. Now, if you're dealing with pelvic tightness and you want to keep squatting, 2 suggestions. 1, you can elevate your heels like I did with the ankle tightness, because that's going to pitch you forward a little bit. And so it's going to take pressure off your pelvis to have to correct to hold the weight as you're doing that, because if my ankles are up, it's easier for me to just sink down with a more neutral pelvis as I'm doing that. The other thing you can do is try a front squat. So you can try holding a bar in the front, or you can just take a dumbbell and do a goblet squat type movement, because this is requiring less anterior tilt of the pelvis by being here, because the weight's not back behind me. I'm not having to arch to hold it. I'm keeping the weight here. I can keep a much more neutral pelvis than if the weight's back here and I have to arch to let that movement happen. So that's a couple good workarounds for the pelvis that you can do temporarily to keep that squat pattern moving while you're working on the mobility on the side with the pelvis. So that covers how I look at the squat when I'm dealing with someone who has a painful or limited squat when they come in. Now, sometimes that's the primary reason they're coming in. Sometimes they're coming in for knee pain. That's part of what we look at. Sometimes they're coming in for shoulder pain and just want to talk about their squat. As I mentioned, the squat is one of the most important functional movements, but also one of the best movements to do in the gym to save a little bit of time and hit a bunch of muscles while you're trying to do it. Now, when you're looking for someone to help you, if this video wasn't enough, which it might not be because we just went over some basic things, we didn't even look at form of squatting, repetition scheme, everything like that. Ideally, you want to find someone who can blend the two worlds together. So a physical therapist is great because they'll be able to break out the individual areas. There's a little bit of pain. What are we looking at mobility-wise? We also want someone who has a training or strength coaching background who can actually look at the form of the squat. You'd be amazed how many people I see who've never actually been taught to squat. And when they come in and say, oh, I have pain with squatting, I say, well, let's squat with a bar on your back. It says, oh, you've never been taught how to do this. We teach them how to do it. And then it's kind of like, oh, there's no pain. We figured it out. It doesn't have to be a complicated physical therapy thing. So a certification like a CSCS or something like that can be helpful to have someone who knows what they're doing when they're looking at you actually moving and then talking about reps, sets, everything like that, just to give you a better idea, just so you're not overdoing it in the gym or underdoing it. And that's the reason for the issue, not ankle limitation or anything like that. So in summary, this is a very basic look at the squats. If you have any questions, you can always email me. It's linked down below. If you're in the Sterling, Virginia area, I'd love to see you come in for an assessment. We can talk through some stuff. We can do some more individualized things. There's obviously a bunch of physical therapy tips and tricks we can use, dry needling, stretching, joint mobilizations, more manual therapy, hands-on stuff. But there are tons of other options we can have with an individualized assessment. So I appreciate you watching. Thank you.